organisation. I'm unfortunately not the director, but this is my colleagues. We're a South African-based organisation that works on HIV, on gender-based violence, on human rights. Our main perspective is focusing on issues around masculinities, and we work to build the capacity of civil society, but also government. And as Satish said, we're part of the global Men Engage Alliance. When my colleague gave me this slide, I noticed that my picture wasn't on it. So I hope that that doesn't mean that I've got some news when I go back to the office. What I want to talk to you about today is three things. First, I want to say a few words on the state of the field on engaging men. I want to share some examples of our work from South Africa. And I want to talk, as Philippe said, about some results from the International Men and Gender Equality Survey. The first thing to say on the state of the field is that we know that these interventions work. We were involved with the World Health Organization in doing a study of programs that specifically try to address issues around masculinity, working with men and boys. And those programs included group education, services, clinical programs, and community outreach mobilization programs. And we worked with the WHO to separate those programs into those that we thought were effective, could show some degree of detailed behavioural change. Those that were promising, the behavioural change was not as strong, but there was still change. And those where it was unclear whether there was behavioural change. And these are all interventions targeting specifically with men, issues around masculinities. We started off with thousands of studies of interventions. One of the challenges, and this is something I'm going to mention, is that we don't have a lot of rigorously well-evaluated programs within this field. So we only had 57 overall that had good enough evaluation data that we could make this conclusion. And my point to you is just to say that if you look at the total percent of effective and promising, if my maths serves me correctly, it's about 63%. So what we wanted to say to the global community, to those working in this field, is we know that this work makes a difference. We know that engaging men and boys does lead to better health outcomes for men. It leads to better health outcomes for women. We know that it can reduce levels of violence. We know that it can reduce levels of STI, and we have the evidence, STIs, and we have the evidence to show this. And I'm happy to give you more information separately if you like. The second thing to say on this evaluation is that we separated the programs into those which we described as gender neutral, gender sensitive, and gender transformative. Gender neutral are programs where there was no difference in the way in which they approached men or women. There was no discussion around men being a specific target group for any particular reason. Gender sensitive was where they said, well, we recognise that there may be differences in the way we need to approach work with men, and they did that. But gender transformative was programs that said, we need to try and work differently with men, but we also want to try and challenge some of the gender norms, the health outcomes, as we've been talking about today. And we want to try and recognise the positive things about masculinity and try to transform areas which could have links to violence, HIV, STIs. And we found that the gender transformative programs were even more effective. So what this is showing us is that programs that not only recognise the need to work specifically with men, but try to engage them in a more transformative way, are much more effective in terms of health outcomes, violence outcomes, etc. Just very quickly, when we say transformative, what that means in terms of how we work is programs which include discussions around how you would influence behaviour and gender norms, but try to enable men and women to critically reflect on these norms, and really to try to achieve a tipping point where in the critical reflection, where men recognise, and women, the ways in which some of the socialisation processes may have affected them in ways which implicate on their behaviour and their behaviour to others. So I would love to talk longer about the state of the field, and I think Satish gave a really excellent overview of all the rich programmes that are out there, but just some conclusions about where we as organisations working in this area feel that the field is at. So we think that there's lots of really good programmes, lots of excellent interventions. Satish has mentioned some have already been shared with us over the last 2 days. However, most interventions you will find, and that's the case in South Africa, targeting issues around masculinities are often small scale, are short term and are limited. There isn't the ability to take that intervention and take it to scale. It often could last for 6 months, for 1 year, for 2 years, but there isn't a longer term approach to this work. It's often not linked to interventions with women, and I think it's really important when we work in this field that we have strong links with programmes that are seeking to do women's empowerment, that are working on women's rights, and sometimes these interventions with men operate in parallel and not together with these interventions. A similar point is that often we target just specifically men, and we know from that WHO research, which also found different effective strategies for doing group education, for doing service clinical work, and for doing community campaigns outreach, that actually if you work with men and women together, sometimes separately, but then bringing them together as a group, you're able to be much more effective. However, we sometimes just target men alone and don't work with men and women together, recognising the relational world in which we live in. A very interesting area for me in this conference has been having the chance to think a little bit more critically about my own conceptual framework, and I think sometimes this work doesn't really think about, well, when we talk about masculinities, are we kind of only talking about what Connell said, or are we being more critical in terms of our understanding of, is it all about social construction, or are we actually talking about social determinants of health and poverty? And I think we struggle sometimes in programmes to be very clear about our conceptual framework. A related point is that we're very good at working with individuals, but we're not so good at working with institutions. So how are we changing the police, political systems, religion, government, to be able to better address these issues, rather than just working for change at an individual level? Focus on the broader determinants, I mentioned that. And a critical challenge is a lack of good evaluation skills and data. We have great programs out there, but we can't evaluate them effectively often. I think ways in which we, as programmers, could strengthen links with academic community would be fantastic, because I think we have a lot that we can gain from you, and a lot that I think you could kind of gain from helping us to improve our evaluation of this work. So, secondly, talking about South Africa, just briefly, without boring you too much, South Africa as a context that does face many public health challenges. We've got the highest rates of HIV in the world. We've got high rates of self-reported domestic violence. In some areas, we've got unemployment as much as 20%. We've got 50% of the population below the poverty line, and that does create a challenge where we need to do this work and do it in an empowering and positive way. And I think sometimes we also, as those of us who work in South Africa, may take a negative approach to working with men. And I think there's a real need to be positive about this work. And to understand the context within which men are living in South Africa. Our approach is very much around saying if we want to achieve change, we have to do it at multiple levels. So we need to work with the individual, but we also need to work with the community, we need to work with the government, we need to do research and evaluation. And only by working at those multiple levels, ensuring that the work that we do at the ground influences the work that we do with government, and vice versa, do we feel that we can make change. And I'd love to find ways in which we can link with you to better strengthen our work at these different levels. Because I think we recognise we're good at some things, but not so good at other things. I want to share 2 examples of our work. One relates to our work in relation to community mobilisation, capacity building, and the other relates to our work on policy and advocacy. Our flagship campaign in South Africa has been called One Man Can, and it's really around getting young men to feel empowered to be able to do things. So, for example, you probably can't read it, but it says, one man can love passionately. One man can change the world. One man can stop domestic violence. One man can break the cycle. One man can demand justice. And we run workshops, and I'm very happy to share this information with people. We run workshops with particular groups of young men where we talk about a range of issues around HIV, violence, around gender equality. And we connect that up to activities in the community where we try to build branches and structures to continue to engage men and women, refugee groups, different groups around these various issues. We had an evaluation of our work in 2009 which showed that we've reached hundreds of thousands of people through this, and we're just working now with a university, UCSF, University of San Francisco, I think. I never remember the acronyms in this part of the world, I'm sorry, to do a broader evaluation about the impact of our work. But again, I'm happy to share further information.